I have to say, when I graduated from dental school, you're never a comprehensive dentist until you learn about orthodontics. You can be lacking skills in maybe endodontics, root canals. You might not even need to take out some teeth as long as you diagnose. You can, just do very simple fillings and crowns. That could last you for a long time, but in order to be a comprehensive dentist where you understand the full structure of the muscle, the face, how everything functions, especially with the joint, you have to understand orthodontics. Like I said, you can always replace something that's broken and maybe do a crown, and that's going to last another 5 years, and then it breaks again. And maybe the second time when it breaks, you have to ask yourself, why did it break? Was there something that's causing the tooth to keep breaking, or is it me that I did not do good work? And most people don't really think about the occlusion, the bite, the orthodontic part of the whole mouth. They just go in and say, well, it's broken, let's fix it. And at some point, you start to zoom out. You said, there is a deeper understanding I need to get to as far as patients' overall health with the joints, starting with the joints and teeth and the gums and function. So once you start looking at that, then you have to look into orthodontics, because a lot of times teeth are not in the right relationship and they're destroying each other unless you move the teeth to put the teeth in a better relationship, and that's when your restorative work is going to last. So this is why we always do orthodontic consultation for every single patient that comes in. And there's always a cause for destruction with the teeth. And the cause of it can be solved by orthodontics by setting up the teeth in the right position. Then any type of restorative work can always last longer. It's more aesthetic, and you end up with a happy patient. At that point, patient doesn't really care how much they need to pay, as long as they know that the occlusion is the best it can be, and all the restorative on top of the occlusion is going to last for a long time. I think the biggest benefit for a general practitioner to do any type of orthodontic treatment with either a liner or bracket is really you are treating the overall system for the patient. You're able to monitor their hygiene, you're able to monitor whether they're getting a cavity somewhere, you're able to monitor how they're, grinding their teeth. And so with seeing that patient in maybe every 6 to 8 weeks, you're able to see what type of, chewing pattern patient has, what type of brushing pattern patient has, and you can understand what their occlusion looks like over that period of time. So I feel like from patient standpoint of view, they really don't like to go to another place for cleanings and another place for braces or aligners and kind of mix things up and then not getting their general dentistry part taken care of. So I think the biggest benefit is we're able to provide patient with a more comprehensive care, which they don't have to go to a few different places to get 2 different treatments done. So that's what patient appreciates too. I think everyone's doing very busy with a lot of restorative work because that has been lacking. During the pandemic, people were not really seeking to have treatments done, so every dentist was very busy, filling up cavities and doing a lot of restorative work. But I think what's interesting is when you do all of that work, you still have to go back and go to the roots of all the problems, which is, putting the teeth in the right place at the first place. So I think post-COVID really, what I learned from, practicing during COVID and post-COVID is people do have higher demand for aesthetics, and people do want to have the best done for their teeth. And having the knowledge to be able to do that is not easy, because you have to really learn. You have to really better yourself as far as your knowledge with, orthodontics, aesthetic, occlusion. And people have the demand, and you just simply have to invest in yourself, invest the time to be able to meet that demand. I think during pandemic, everyone started to think about a couple of things. One is, would I be still happy if I died tomorrow from COVID, right? Or if I go back to the same thing I do again, am I gonna still be happy? So for me, seeing patients having a different attitude toward how they want their teeth to be, I think that is the biggest change that I've seen within patients. A lot of patients maybe did not want to do some of the things that I suggested them to do because of financial or, just time. But then after pandemic, they always feel like first thing is I need to get better health, so I need to improve how my teeth are, how my health are. So they are more conscientious about asking for more treatments. Orthodontic is one of the things that they do ask quite a lot, because a lot of patients was like, well, I'm old enough, I don't need to make my teeth straight. But once they have that life and death experience, and they're like, I'm gonna live my life to the fullest. If I want my teeth to be straight, I'm gonna come in and get something done. So I think it's a positive attitude as far as helping the patient improve their overall health. I usually leave it up to the patient. When I do a consultation with my patient, I always ask them. I say, hey, you're here for me to fix your teeth, and you're paying me to do the work. Which one do you want me to do? I could do either one, and I can do either braces or aligners, and they're all going to be at the level that we are trying to achieve for, at the best of ability to achieve at the highest level. So patients really have already a predetermined type of appliance they want to use, but sometimes they are not really so sure of which one yet, just because everyone wants aligners, but they're not sure if they can use it, and everyone shies away from braces. But I have patients that do want to have braces because aligners simply can't work with their busy schedule. So for me, I just simply need to use one type of orthodontic appliance, brackets or aligners, to be able to achieve the best result, knowing what needed to be accomplished. So between brackets and aligners, there's really not so much of a treatment result difference. It's more so of patient preference, and more so of what you know about the efficiencies of each system, and then the inefficiencies of each system, and then you merge the two and you figure out, okay, this is what I will be able to accomplish with braces or aligners, and then let the patient kind of decide. The most important thing is really not braces or aligners, is patient wants to have the orthodontic treatment. So brackets are definitely more efficient as far as some certain movements over aligners. Aligners are efficient in many aspects if patient can actually wear the aligners. But with this age, a lot of patients cannot simply use aligners. If I see a mom of 5 kids, and with a baby in their hand, and she wants to do aligners, I simply would just say, you know what, this is not going to work for you. Your aligners are either going to get thrown away by one of your kids, or if you have a dog, they're going to, pretty much use it as a chew toy. So I will make that decision for the patient at that point based on what I know about the patient. So when I see a patient for consultation for braces or aligners, it's more about what is your current situation? Like, are you working? Are you having kids? What are your plans? I know it's asking a lot of personal information, but those always will help me decide which appliances will be best for them. But overall, braces is, I tell patient, you let me do the work and then I can always get it done. But aligners is not as efficient in that sense, because sometimes patients just start to lose patience to wear the aligners, especially toward the end of the treatment when I feel like there's still a lot of things I need to tweak, and the patient simply don't see it. And then it's hard to get the patient to understand what my treatment plan goal is at that point. So even with some aligner cases, I would finish with braces just so that I could get the best aesthetic results. I feel like the best word of advice is always word of mouth. So when I go to a restaurant, I check Yelp review. It's helpful, but if the restaurant is within the area where I know someone lives there, I always ask my friend, or you ask your friends to see, hey, is that restaurant, how's the food? Do you like it? That's the best type of marketing that anybody can do in any practice, because you have tons of patients that's sitting there and they trust you. They keep coming back every 4 to 6 months, and they obviously come back for a reason, because they like you, they like the way you practice. And for us to ask patients for more patients, it's very spontaneous, right? Like, I need to keep my practice afloat, so I always need to have new patients. So you just simply ask your patient, you say, hey, you have any family members that, are you happy with our service? Are you happy with what we do for you? If you do, please, refer anybody that you know. We always need new patients. And surprisingly, every patient that I ask, they always have this earning to help you. They're like, Dr. you need a patient. Let me just go back and I'm going to tell all of my friends about you. And one is you do good work, and sometimes they're just like, well, the pricing is much better. Sometimes is you do everything here. So there's always 1 or 2 points that the patient are happy about. So simply ask the patient, like, are you happy with our service? Are you happy with our cleanings? Are you happy with, the way the front desk, everybody treats you here? If you feel like happy, please refer patients to us. That is internal marketing. I think that is the best for you to establish a bigger orthodontic practice. External marketing can work if you have, tons of good reviews and you have patient that comes in that is looking for certain things that you provide. And establishing that trust between, patients when the patient come in because of the ad, it's a little bit more difficult because people don't go to another place, just automatically trust the providers. So it takes a little bit more time. But I feel like the internal marketing, just simply ask patient, I need more patients. I need more people in my practice for us to be, keeping up with our flow of the practice. Can you, send me a coworker? Hey, send me, people that live downstairs from you, your neighbors, your cousins, your, in-laws, your exes, So that's the best way to do. So if you had braces or orthodontics before, like how I did it, I had braces when I was in dental school, 20 years ago. And teeth are always going to move if you're not using retainers to keep them where they are. And then just get to a point where you think, well, I'm really not happy with the way the teeth look, and You just have to seek more treatments. It's either with more braces or more aligners. You can do either one. But that is the only way. If you're not happy about something, whether it's your teeth, your weight, your hair, your feet, your toes, your fingers, you just have to take the step and do something, right? So either braces or aligners will always work, and after that's done, and we're a creature of habit. If we didn't wear a retainer the first time, we're most likely not going to wear retainers again. So if I'm treating a patient that I retreat again, I usually make sure I give them a better type of retention, like maybe a permanent retainer, just so that they don't have to go through the hassle of treatments again.